Hi guys, so last time we talked about the frontal lobe and the zygomatic bone, which is this one, and also maxilla. Today we're gonna talk about the mandible, the occipital, and a little bit about the structures around them. So, the first structure to go over is of course the mandible, which is this structure here. This is your jaw, so this is the only movable bone in your skull, which is the mandible. The mandible is made up of a few different structures. The first one to pay attention to is this area here. This is known as the body of the mandible. And this entire area here is known as the ramus. So mandibular ramus, or the ramus of the mandible. Also, if you pay attention, there's a hole right here. If I move the structure a bit, you guys can see this hole here, and this hole is known as the mental foramen. So it's a hole. It's a foramen. That's why it's called a foramen, and it's also a mental foramen. So this is the body. This is the ramus of the mandible. Two more structures to pay attention to is this round structure here, this one, and this is a condyle. So if you guys know from your anatomy terminology, condyle is around the structure, which is what we see here. So this is a mandibular condyle, and right here underneath the zygomatic bone, this is the chronoid process. So I don't know if you guys can see it. It's the chronoid process, and you got to be very specific if you watched my humerus tutorial. You know that there is a chronoid fossa at the bottom region of the humerus. So you gotta say that this is the chronoid process of the mandible. You gotta be very, very specific with that. Two more structures to talk about is one of them is this one here. So that you're looking at the posterior view, and you guys can see two holes here. So again, looking at the posterior view, there are two holes here, and these are known as the mandibular. It's a hole, so it's a foramen. So again, the bones here are known as the mandibular foramen. And finally, the last structure to talk about in the mandible is the mandibular fossa, and is this structure right behind the condyle. Maybe I can if I take out the mandible, you guys can see this better. Oops. Okay, so this structure here, this is known as the mandibular fossa, and this as the place for the mandibular condyle, which is where it attaches to. And that sums up the mandible. Now we can talk about the temporal bone. Okay, so the temporal bone, there are a few structures to pay attention to. The first one is this round structure here, and you can actually if you go behind your ear and if you touch on that very hard bony structure right behind your ear, that's the mastoid process. And again, mastoid, the word mastoids come from the word rock, which is a very hard bone right behind your ear. And also there's another bone to look at, is this very pointy bone here. So it's known as the styloid process. So again, if you, let me write it here, it's styloid process. So again, if you remember one of my tutorials, the ulna and radius, they both have the styloid process as towards your hand. So you got to be very specific when naming these structures. You got to say the styloid process of the temporal bone. You got to be very specific. And also the point of this structure is to connect it to the hyoid bone, which is this bone here, the hyoid bone. So there's a ligament that attaches these two bony structures. And there's one more structure, this big hole here. This is actually for your ear, the hearing, and I'll make a tutorial for that later. This is known as the external. So if there's external, know that there's internal. Acoustic Meatus. So this is known as the external acoustic Meatus. And if we look inside the skull, which I'll do in a sec, there's an internal acoustic Meatus. So directly on the opposite side, let me actually show you. So let me take out this bone here. Oops. Let's take out the occipital bone too. So again, this hole here, big hole here, is known as the external acoustic Meatus. And now this hole here is known as the internal acoustic Meatus. So you got to see it's actually known as the internal acoustic foramen, because it's not like the other one. It's just a hole. They don't connect. So that sums it up for the temporal bone. Now we can talk about a few other structures. So let me isolate the skull. So going back to the mandible and maxilla, and if you recall, this was the maxilla and this is the mandible. Now looking at the inferior view, actually turn the structure. Okay. So looking at the inferior view, if you recall, this was the maxilla. So this is the maxilla. This structure here is known as the Palatine Bone. So Palatine Bone. So yes, this entire structure here is known as the Palatine Bone. So one thing to look at on the Palatine Bone is the process. So right about here, this is known as the Palatine process of the Zygomatic bone. Again, if you go back to my previous tutorial for the skull, you'll see how that's exactly worded. So that would be Palatine process of of maxilla bone. So again, it's attached to the maxilla, so this specific point here, and this is known as the Palatine process of the maxilla bone. And that's pretty much it for that part. And we can also talk about the pterygoid plates, which are these two AG structures on the left. Let me just zoom out so you guys can get the big picture. So this is the skull, looking at the posterior view, and right behind the hyoid bone, you see two AG structures. This one and the one behind it. So let me zoom in. Okay, there you go. I feel like that's the best. This one and this one. These are the pterygoid plates. Plates. And there's a Y here. You write that. So it's pterygoid plates. So there are two of them. If I zoom in, you can see it. There are two of them. The one in the center toward the middle of the body, that's known as the medial pterygoid plate, and this is known as the lateral pterygoid plate. And okay, so those are the pterygoid plates. And two more structures. So now moving down a bit on the sphenoid bone, which is this bone here. This is the sphenoid bone, and this, yeah, as you can see, it involves all the pterygoid plates and all of that. You see this hole right in the middle, this one, and this is known as the carotid canal. So carotid canal. And right next to the carotid canal, I'll move the structure in a bit, you see the jugular foramen. So there's another hole there, so that's the jugular foramen. So this big hole here and here, as you can see, is the carotid canal. The hole next to it is known as the jugular foramen. So let's move the structure a bit. You can see that big hole is the carotid canal, and that's the jugular foramen. So the first structure to pay attention to is the big one in the middle, this guy here. This is the magnum foramen. Foramen. It's a very big hole foramen. It's where the spinal cord goes through and it connects to the brain. So looking at the occipital bone, which is this big bone here, the first structure to pay attention to is the occipital condyles, which is these two small bone here, occipital condyle. And you see two holes right next to them, and these are known as the condylar canals. So these two bones, so these are known as the condylar canal. So again, this big one here is the occipital condyle, and the small ones are condylar canals. And also one more structure to look at on the occipital bone. Moving the structure a bit. You see this bump here, and you can actually, if you touch behind your back, right, behind your head right now, you'll see this bone here, and this is known as the external occipital protuberance. So protuberance. So again, it's the external occipital protuberance right there. And that's pretty much all the things I wanted to talk about on the skull, at least for the second tutorial. We'll finish it up in the third tutorial, and see you guys till then.